Of course, here is a comprehensive overview of the human cardiovascular system, broken down into easy-to-understand sections. Overview. The body's delivery network. Think of the cardiovascular system as your body's sophisticated transportation network. Its primary function is to deliver essential supplies, oxygen and nutrients, to every single cell and remove waste products, like carbon dioxide. This system is also crucial for regulating body temperature, fighting disease, and carrying hormones. The three main components are 1. The heart, the pump. 2. The blood vessels, the pipes. 3. The blood, the fluid being transported. The heart is a muscular organ about the size of your fist, located slightly left of the center of your chest. Structure: it has 4 chambers. Atria, singular, atrium. The 2 upper chambers, they are the receiving chambers. Right atrium receives deoxygenated blood from the body. Left atrium receives oxygenated blood from the lungs. Ventricles, the 2 lower chambers, they are the powerful pumping chambers. Right ventricle pumps deoxygenated blood to the lungs. Left ventricle pumps oxygenated blood to the entire body. Its muscle is the thickest because it has to generate enough force to push blood through the vast systemic circuit. Valves. These are one-way gates that prevent the backflow of blood, ensuring it moves in the correct direction. The 4 main valves are the tricuspid, pulmonary, mitral, bicuspid, and aortic valves. The double pump action. The heart is effectively 2 pumps in one. Right side, pulmonary circuit. Pumps blood to the lungs to pick up oxygen and release carbon dioxide. Left side, systemic circuit. Pumps oxygen-rich blood to the rest of the body. The sequential contraction and relaxation of these chambers is what creates your heartbeat. This is a vast network of tubes that carries blood throughout the body. There are 3 main types. Arteries carry blood away from the heart. They have thick, muscular, and elastic walls to withstand the high pressure of blood being pumped from the ventricles. The largest artery is the aorta. Arterioles, smaller branches of arteries that lead into capillaries. Veins carry blood back toward the heart. Their walls are thinner and less muscular. Since the pressure is much lower here, many veins have valves to prevent blood from flowing backward. The largest vein is the vena cava, capillaries, the smallest and most numerous blood vessels. Their walls are extremely thin, only 1 cell thick. This is the exchange zone, where the real work of the cardiovascular system happens. Oxygen and nutrients diffuse out of the blood and into the body's cells. Carbon dioxide and other waste products diffuse from the cells into the blood. Blood is a specialized connective tissue that is composed of several components suspended in a liquid called plasma. Plasma, about 55% of blood volume. This is mostly water, but it also contains proteins for clotting and immunity, hormones, nutrients, glucose, amino acids, and waste products. Red blood cells, erythrocytes, the most abundant cell. They contain hemoglobin, an iron-rich protein that binds to oxygen and gives blood its red color. Their job is to transport oxygen. White blood cells, leukocytes. The soldiers of the immune system. They defend the body against infection and disease. Platelets, thrombocytes. Tiny cell fragments that are essential for clotting, sealing wounds to prevent excessive blood loss. The blood flows through 2 interconnected circuits simultaneously. 1. Pulmonary circuit, heart, lungs, heart. Deoxygenated blood from the body enters the right atrium. It passes into the right ventricle, which pumps it through the pulmonary arteries to the lungs. In the lung capillaries, CO2 is dropped off and O2 is picked up. The now oxygenated blood returns to the left atrium via the pulmonary veins. 2. Systemic circuit, heart, body, heart. Oxygenated blood from the lungs enters the left atrium. It passes into the left ventricle, which pumps it into the aorta. The aorta branches into arteries that carry blood to all body tissues: head, arms, organs, legs. In the body's capillaries, O2 and nutrients are delivered, and CO2 and wastes are picked up. The now deoxygenated blood returns to the right atrium via the superior and inferior vena cavae, and the cycle repeats. This diagram illustrates the path of blood through the heart and the 2 circuits Key functions, a summary: transportation, O2, CO2, nutrients, waste, hormones. Regulation, helps regulate body temperature by directing blood flow to or away from the skin, and pH. Protection, white blood cells fight infection. Platelets and clotting factors prevent blood loss. Common disorders. When this system malfunctions, it can lead to serious health issues: atherosclerosis, the buildup of fatty plaques, cholesterol in arteries, narrowing them; hypertension, chronically high blood pressure, which can damage blood vessels and the heart; coronary artery disease, CAD, atherosclerosis in the arteries supplying the heart muscle, which can lead to a heart attack; stroke, a blockage or rupture of an artery in the brain, cutting off blood supply; heart failure. The heart becomes too weak to pump blood effectively. Maintaining a healthy lifestyle, a balanced diet, regular exercise, and not smoking is the best way to care for your cardiovascular system.
Of course, this is an excellent and important question, as these two conditions often occur together. Here is a detailed explanation of coarctation of the aorta, CoA, and a bicuspid aortic valve, BAV. Overview: two related but distinct conditions. Imagine the heart's main pipeline, the aorta, has two problems. 1. A pinched hose, a severe narrowing, the coarctation. 2. A faulty valve, an aortic valve that has only 2 leaflets instead of the normal 3, bicuspid aortic valve. These are both congenital conditions, meaning a person is born with them. They are the two most common congenital heart defects found in adults, and they frequently occur together. Part 1. Bicuspid aortic valve, BAV. What is it? The aortic valve is the gate between the left ventricle, the heart's main pumping chamber, and the aorta, the main artery to the body. A normal aortic valve has 3 leaflets, or cusps, that open widely and close tightly. In BAV, the valve has only 2 leaflets. This malformation can cause 2 main problems: stenosis. The valve doesn't open fully, forcing the heart to pump harder to push blood through the narrow opening. Regurgitation. The valve doesn't close tightly, allowing blood to leak backward into the heart. Why is it significant? It's common. It affects about 1 to 2% of the population. It causes extra work for the heart. Over time, stenosis or regurgitation can strain the left ventricle, causing it to thicken and eventually weaken. It's linked to aortic enlargement. The wall of the aorta just above the valve is often weaker and can dilate over time, a condition called aortopathy. Part 2. Coarctation of the aorta, CoA. What is it? It is a localized narrowing of the aorta, typically occurring just after the artery that supplies the left arm, the aortic isthmus, and right before the aorta travels down to the lower body. Think of it like a severe pinch in a garden hose. What are the consequences? This narrowing obstructs blood flow to the lower half of the body. High blood pressure in the upper body. The left ventricle has to generate extremely high pressure to force blood through the narrow segment. This leads to severe hypertension in the head and arms. Low blood pressure in the lower body. The blood flow reaching the abdomen and legs is reduced, leading to weaker pulses in the groin and feet. Strain on the heart. The left ventricle must pump against this high resistance, causing it to thicken, hypertrophy, and potentially fail over time. Collateral circulation. The body may create detour blood vessels to bypass the coarctation. While helpful, this is a sign of a significant obstruction. The combined condition, CoA plus BAV. When these two conditions occur together, they create a complex and synergistic challenge for the heart. The double strain on the heart. 1. The coarctation creates a major obstruction after the valve. 2. The bicuspid valve can create an obstruction at the valve. This means the left ventricle faces a double whammy. It has to work incredibly hard to overcome both potential blockages. This significantly increases the strain on the heart muscle compared to having either condition alone. The aortopathy connection. Both BAV and CoA are independently associated with abnormalities in the aortic wall. When combined, the risk of having a weakened, dilated aorta is higher, requiring careful monitoring of the aortic size. Symptoms and how it's diagnosed. In infants, can present with severe heart failure, difficulty breathing, poor feeding, and shock when the ductus arteriosus, a fetal blood vessel, closes. In children, adults, often discovered due to high blood pressure in the arms, often during a routine checkup. A significant blood pressure difference between the arms and legs. A heart murmur from the BAV or the coarctation. Headaches, nosebleeds, leg cramps, or cold feet. Diagnostic tools include echocardiogram, MRI or CT angiography, and cardiac catheterization. Echocardiogram, ultrasound of the heart. The primary tool to visualize both the BAV and the COA. MRI or CT angiography provides detailed 3D images of the aorta and is crucial for planning treatment and lifelong monitoring. Cardiac catheterization can be used for both diagnosis and treatment. This is a lifelong condition managed by a team of congenital heart disease specialists. Repair of the coarctation. This is usually the first priority, especially if the narrowing is severe. This can be done via surgery, removing the narrowed segment and reconnecting the aorta or using a patch. Balloon angioplasty and stenting. A less invasive procedure where a catheter is used to inflate a balloon and place a stent to hold the narrowed section open. This is common in older children and adults. Management of the bicuspid aortic valve. Monitoring. Many people with BAV don't need immediate intervention, but require regular echocardiograms to monitor for stenosis, regurgitation, or aortic enlargement. Medication. To control blood pressure and reduce stress on the aorta, e.g. beta blockers. Valve. Intervention. If the valve becomes too narrow or leaky, it may need to be replaced or repaired via open heart surgery or a catheter-based procedure, TAVR. With successful treatment and lifelong specialized care, most people with this combined condition can live full and active lives. However, they are not cured. Key aspects of long-term care include routine monitoring, annual or biannual checkups with echocardiograms, and occasional MRIs. Strict blood pressure control, essential to protect the heart, the repaired aorta, and the valve. Endocarditis. Prophylaxis. Antibiotics may be recommended before certain dental procedures to prevent heart valve infections. Healthy lifestyle. Maintaining a healthy weight, not smoking, and regular appropriate exercise are crucial. In summary, coarctation of the aorta with a bicuspid aortic valve is a complex but manageable congenital heart condition. The combination places significant strain on the heart and aorta, requiring careful diagnosis, timely intervention, and lifelong follow-up with a cardiologist who specializes in adult congenital heart disease.